Capital Views is sponsored by Northrim Bank, Alaska Oil and Gas Association, ConocoPhillips, and Linden.
Hi, I'm Tim Bradner with Alaska Legislative Digest, and welcome today to Capitol Views, and a special welcome to Heidi Hedberg of the Department of Health. So thank you for joining us today, Commissioner.
Thank you so much, Tim. I appreciate being here with you today.
Commissioner, your department, and you've been there a long time in the predecessor organization of the Department of Health and Social Services, and the pandemic was a pretty interesting time, pretty busy time. Maybe you could talk a little bit about the department's role in that, and maybe at the beginning also touch on your own background. So thanks for doing this.
Yeah, thanks, Tim. So before I came into public service, I spent 13 years working in the nonprofits, traveling around the state. And I think that really helped me develop a lot of relationship in communities. August, I can't believe it, will be my 15th anniversary. And that was under the Department of Health and Social Services. And I started off as a program coordinator and essentially worked my way through different positions. I would say that it was great starting off as a program coordinator because it gave me different perspectives and really allowed me to travel to a lot of hospitals and really build those relationships with hospitals and the tribal health organizations. And so when Governor Dunleavy took his first term, started his first term under Commissioner Crum, he asked me to become the director of public health. And I said yes, along with Dr. Ann Zink as our chief medical officer. And her and I worked very closely with Commissioner Crum and the governor on the pandemic response. I, as part of Unified Command, was represented at the department with public safety and homeland security emergency management. And my role was really the logistics, the coordinating with our federal agencies, working very closely with our tribal partners, rolling out the vaccine program, and working with the healthcare sector. When they had a workforce shortage, I was able to support a contract to get additional staffing up to support Alaskans, and working with the industries to keep businesses open, and working with communities to make sure that communities had the information. Every community responded differently. Our role was to provide the resources in the information so that communities felt informed and they can make informed decisions.
Well, Commissioner, hopefully the pandemic, Alaska came through the pandemic in pretty good shape, thanks to the work that you and your team and others did. What's on your plate now? Do we have any sort of pending new emergencies, new virus outbreaks? Hopefully, and not another pandemic.
There's a lot of infectious diseases that are circulating around the world. Again, our mission is really to promote the health and the well-being and self-sufficiency of Alaskans. And so we are always sharing the information that we know and really helping communities and Alaskans make informed decisions. I would say coming out of the pandemic, there was a lot of focus in that space. And then there was a department reorg. And so Department of Health in July celebrated our 1-year anniversary, which was great. And so with a smaller department, we really are taking, we have more bandwidth to really focus in on the healthcare system, recognizing that there's a lot of areas that we need to focus on. So last year, the governor announced his Healthy Families Initiative, which is, again, healthy beginnings, improving access in healthy communities. And under that Healthy Families Initiative, we have 4 major arcs of effort that we're engaged in. With childcare, the governor launched a task force, and we have been working with all of our stakeholders across the state in making some really informed decisions. And so our first report was submitted to the governor in December of 2023, and that was focused on recommendations around how to improve background checks, reduce the barriers to licensing, and increase workforce. And so there's 33 recommendations around those three areas. The next report is focusing on access, quality, and subsidies. That report will be done and submitted to the governor July 2024. So really looking forward to the work ahead of us and some of the recommendations we've already started to implement. I would say the other focus areas that we have is around transformation of care, how we spend that dollar. We really want to focus on early intervention to decrease those very cost prohibitive downstream treatment costs. We know that a healthier population equals a healthier workforce and a healthier economy. So how can we really lean into that space? And then we're also looking at our behavioral health, access to behavioral health. We know that there's gaps in the continuum of care. And so we have been working extensively over the last 8 months with all of our stakeholders and communities to really identify what are those gaps and how we can shore them up over the remaining 2 years. And then the fourth arc of effort is around complex care. We have some very vulnerable Alaskans that have a lot of complex needs. And so working with the Department of Family and Community Services on how we can meet those individual needs and support them in the best setting as possible.
Commissioner, you have a full plate. Are you facing any staffing shortages? How about recruitment and retention of your staff, particularly your, such as your public health nurses?
Yeah, I am thankful to report that we've had a decrease vacancy rate in public health nursing. The legislature did appropriate some additional funds last year, and we've been able to use those funds to support some incentives around the recruitment and retention of our public health nurses. So very excited to report that we do have a decrease. Overall, our vacancy rate in the department is slowly decreasing. And we've been really intentional about doing a variety of things in supporting our staff and really hearing from them what would help them in their job. I think of sort of three areas. What are the resources you need to do to support your job? Supporting a positive work culture, and then the compensation. And there's a lot of things to unpack around compensation. And there's a lot of things that we do, from our loan reimbursement program to paying for moving expenses to paying for professional development, tuition reimbursement, alternate work weeks. So again, there's a lot of things around compensation. I think those three areas that we're focusing in on to help in that space so that we can retain our amazing staff.
Oh, well, Commissioner, this it's a big challenge facing you and your staff and really all of us. So thank you for joining us today.
Thank you, Tim. I appreciate it. Take care.